السلام عليكم ويا مرحبا بكم في Emirates Society of Ophthalmology Conference بنسختها ال21. اليوم راح يكون معنا لقاء شيق مع دكتورة وضحة السعدون، اختصاصي جراحات القرنية والمياه البيضاء من إمارة الكويت. غنية عن التعريف. She did her fellowship in Ottawa in cornea anterior segment to complex anterior segment surgeries in Ottawa. She currently practices in مستشفى عالية ومستشفى البحار في الكويت. Our interview is going to be a mix of English and Arabic. So حياك الله دكتورة وضحة معانا.
الله يحييك آمنة، شكرا على الاستضافة، وايد مستمتعة بالإيزو.
دكتورة وضحة، كان فيه إثراء عالي وصدى كبير your talk that you gave yesterday afternoon on the first session of EZO, the 21st edition. Tell us more about your talk and about iris reconstruction specifically.
بالأمس كان كلامي أو محاضرتي عن القزحية الصناعية. I'll talk in English better. I was talking about iris implants, أنواعها وشنو ال benefits and risks of each one. تكلمت عن the newest and FDA approved custom flex iris implants تبع human optics. إن الشيء الحلو فيها إنه we take an image أو ناخذ صورة من العين السليمة we can do a copy أو mirror image حقها حق العين الثانية. فهير we solve a cosmetic issue, we cause functional issue مثل monocular diplopia والglare. Recovery is very fast, minimal sutures, very small incision لأن نستخدم الكارتلج to load it. بشكل عام it's a new advancement in anterior segment surgeries which I like to practice a lot.
The spectrum of patients that you can offer such a technology to them, who would be your selected people?
So I would offer this, أول شيء, just to clarify, this is not a cosmetic implant. This is totally a therapeutic implant. This is offered for patients who are congenitally aniridic or that had any trauma, iris loss for any reason, including iatrogenic iris loss and floppy iris syndrome or others, but mainly for trauma in aniridic patients.
Amazing. The quality of care you're providing as well as improving their quality of lifestyle, honestly, hats off. Tell us more about the other aspect of your practice, being a cornea surgeon. What kind of people, I like to refer to them as people, that come to your clinic, what kind of pathologies they tend to come with, and what do you offer them?
Okay, so being an anterior segment surgeon and a cornea surgeon, most of my clinic is cornea basically and refractive. So I see all core cases of corneal pathologies. I do all types of transplants, the anterior and the posterior. I think I'm very confident with especially the endothelial keratoplasties. I did very high numbers in my fellowship. And I think this is something new that we introduced to the Kuwait health system to do the endothelial keratoplasties. This is regarding the types of transplant, but I do also the complex cataract surgeries, the basic ones. Now I am doing many types of lenses, the typical monofocal, the toric lenses, the extended depth of focus, and the multifocal ones. And the last aspect of my practice, which is a huge practice actually, the refractive surgery. So I do all types of refractive surgeries. I do like smile surgery a lot, the lenticule surgery. I do also LASIK and PRK. I do special testings for these patients to have them satisfied after the surgery.
What would be the age of patients presenting to you requesting such a service, whether it was a lenticular surgery or whether it was an excimer approach to help them get rid of their glasses? If you can elaborate more on those.
Yeah, so basically patients who want to get rid of glasses, they usually come after the age of 18. Actually, the guidelines say we cannot do any refractive procedure unless the patient is at least 18 to have stabilized the refractive error. So usually they come around the age of 18 or few months before becoming 18 when they want to join military. So here, this group of people are the refractive and the keratorefractive, I mean, dealing with laser. The other group of people is when after the age of 50, around 60s, 70s, maybe they come for cataract surgery, and now they're very well educated to know what type of lens is going to be implanted and what are the what are the benefits of each lens, and what do they expect from each lens. So I think now with our social media and with our technologies, people are very, very well educated, and they want to know what type of lenses is going to be implanted, what it's going to add for them, what to expect, and everything.
If you come to talk about the bulk of your consultation time, where do you think you are paying more attention to when you see a patient in your clinic?
So, cornea maybe. I think most of my patients are cornea patients, and most of them either a keratorefractive or a transplant patient. I do lots of cataract, but I think the bulk is either keratorefractive or transplant.
When it comes to, I was to ask you regarding where do you feel you lean towards more doing your area of interest? Would it be iris, since you gave a beautiful talk about iris reconstruction? Would it be corneal transplants and the various modalities you mentioned? Or the refractive, whether it was excimer or lenticular? Where do you feel Dr. Wadha is shining in the most?
Well, I feel this is a difficult question. I like them all. I like the cornea the most.
Beautiful.
Although I spoke about iris, but iris, I think it's the least procedure that is done by ophthalmologists. I don't think many of them do like iris work because it's complex. I love to do corneal transplants. I am very the highest number that I have done is the corneal transplant itself. I've done many iris works, but still the corneal transplant is always the highest. Yeah.
Beautiful. How many time we have left? Okay. So thank you so much for joining us in this quick interview with Dr. Wadha Saadon. Stay tuned to what comes next in ESO 21st, 2024. See you around.